Every weekend in the NFL and in college football, players get diagnosed with concussions as a result of hits like this,
The good run, slides.
and unfortunately like this one.
37, Cyprian.
Now, whenever the sideline staff suspect a player might have a concussion, they get brought off the field and taken to this blue mystery medical tent that popped up a few years ago. And inside that tent, a bunch of doctors do some unknown stuff, and unfortunately, sometimes that tent tries to eat you if you're Russell Wilson. Now, we all know that the NFL has been under a lot of scrutiny in the past few years about the way that it handles concussions, and particularly their concussion protocol. So in today's video, instead of breaking down a specific player injury, I'm going to take you behind the scenes into that blue medical tent and into the locker room to tell you in a little bit more simple terms what exactly those medical team members are doing whenever they suspect a player has had a concussion and they're trying to evaluate them. There's basically two ways that the concussion protocol can get triggered. The first is if a player has suffered some sort of head impact or head injury and displays or exhibits signs or symptoms of a concussion. And the second way is if any of the team that's responsible for monitoring concussions reviews video replay and is concerned that a player might have in fact suffered a head injury. The player is immediately brought over to the sideline to do the initial screening for the process of determining a concussion. And this is where that blue medical tent hops in. So that was something that was done in college football for a number of years and was brought to the NFL around the 2017 season. The first step in this whole process is to look for what they consider no-go features. Now, these include the presence of any loss of consciousness, impact seizures, if a player is in the fencing position, which is described as sort of one arm extended out from the body and is a sign of some internal head injury, if they have any gross motor instability such as stumbling on the field or falling over, and then any persistent confusion or amnesia, which is memory loss. If they meet any of these no-go criteria, they're supposed to be immediately taken out of the game and not allowed to return to play until they've been reevaluated after the game is over. The next thing they'll do when they get into the medical tent on the sideline is start to ask the player sort of a review of symptoms and a history. One of the first things they want to ask the player is what they remember happening. What happened to cause the impact? What happened to cause that head injury? Next, they always ask about specific concussion symptoms, and these can be pretty broad, but think of anything that you might get as a result of hitting your head really hard. So things like headaches, changes in vision, difficulty with speech, confusion, dizziness, if they feel weak or have numbness anywhere. Those are all symptoms that are suggestive of a concussion. Next, they'll ask them a series of questions called the Maddox questions, and this includes 5 questions that are pertainable exactly to that sport. And they all deal with sort of orientation, or understanding where the person is and what time it is. So they ask things like, what half of the game is it? Who are we playing? Who did we play last week? What's the score? Questions designed to try to ascertain the player's orientation and awareness of the current time and place. And then they move on to their focused neurologic exam. And this is the part that a lot of people probably don't understand what exactly the physician or the trainers are doing. Now, everything they're doing in this exam is intended, first of all, to look for any signs of a really severe traumatic head injury, such as a head bleed or some sort of intracranial damage to the brain that could catastrophically get worse. The first thing they'll do is a cervical spine exam. So the cervical spine is essentially the neck, and they'll check the range of motion of the neck in all different directions, checking to see if there's any pain or reduced range of motion. They'll check for tenderness by palpating along the spine because that could signify some sort of fracture or bone injury. The next thing they'll do is evaluate the player's speech because, again, if there's any severe process going on in the brain, the speech can certainly be affected. They'll watch the player's gait, and basically they're looking to see if the player is stumbling because, again, those can all be signs of some sort of damage to the structures of the brain. And then they check eye movements and a pupil exam. So the pupils are the dark circles in your eyes, and based on how big or how small the pupils are and how they react appropriately can tell us if there's something more serious going on inside the brain. Similarly with eye movements. So if you ever go to the doctor and you see them do this thing where they tell you to follow their finger, they're checking all of your eye muscles. We have a number of eye muscles that control the different directions and have to work together. And if there's any abnormality where one eye is doing some weird thing, that signifies there could be pressure in the brain that's damaging those nerves and those muscles. If any of that previous stuff is positive or has further suspicion of a concussion, then the player gets taken back to the locker room for a more extensive and comprehensive concussion evaluation. Whenever they get into the locker room, what they do are 2 main things. They perform something called the SCAT, or the SCAT, and that stands for the Sideline Concussion Assessment Tool. This is something that's used and recognized by pretty much the whole medical community as one of the major screening evaluations for concussion. It was developed by an international committee of experts, and we'll throw it up here on the screen. It's actually pretty extensive. It goes into a lot of detail about asking different symptoms, kind of some of those similar questions from before. It's an evaluation that can take sometimes like 10 to 15 minutes to actually perform, but is meant to be more detailed whenever you're concerned about a concussion. But this is the same tool that we use at times when we're covering like high school football games. It can take more time, but there's nothing unique about this SCAT to the NFL. It's a tool that all doctors are available to have to use in their clinics and on the sidelines, and we do the same thing, whether or not this is Tom Brady in the NFL or this is some 12-year-old football player that you're covering on a weeknight game. The other thing they do in the locker room is a full neurologic exam, and this is really important because it's a physical exam that helps to pick up on any signs of a possible head injury. So think about it. Whenever our brain gets injured, it could potentially display different signs on physical exam that might indicate that something's wrong. There's a lot of different components to a neurologic exam, but essentially you're checking a number of key things. You're checking the patient's mental status, so in other words, how aware are they, what's their memory, what's their thinking, their mental clarity. You're checking what we call cranial nerves, and cranial just is a fancy word for head. So you're checking the nerves that control the functions in the head. So eye movements, pupils, hearing, swallowing, taste, smell, vision. Then you always check muscle strength. They'll check sensation by touching different areas of the skin to determine if the athlete has any loss of sensation. They'll check reflexes, they'll check balance, they'll check coordination. They'll check everything that could possibly be affected by something damaged in the brain that could show up on a physical exam. If all of that assessment in the locker room is completely normal, then the player is allowed to go back onto the field. If any of that's positive, then they have to sit out for the rest of the game until they can be reevaluated by a provider and go through the return to play protocol. There's nothing really unique and special about what they're doing on an NFL or a college field compared to what we're doing in the clinic just down the road whenever someone falls and hits their head. We'll break it down in a different video what goes into the return to play protocol that everybody has to go through when they're in the concussion protocol in the NFL. And I hope that was educational. Like I said, not talking about a specific athlete in particular, but something that's a hot topic in the NFL, something that hopefully now you have a better idea of the process and the sequence of what's going on when a player goes into that blue medical tent and then gets taken back into the locker room for more evaluation. So until next time, everybody take care and thanks for watching. Bye.